Good morning, ladies and gentlemen. Good morning, everyone. Good morning, everyone, and welcome to the 2025 Australian Mental Health Prize. My name's Sophie Scott. I'm the chair of the committee, and I'd like to start by giving a warm welcome to Auntie Lola Ryan to the stage. Give her a round of applause. She's an amazing Aboriginal woman from La Perouse, and she's a devoted mother to three, and then also she loves spending time with her three grandchildren. So we're very honoured that she's taken the time today to come and do our important welcome to country. Thank you.
Thank you. Nagan binagan anilola, nagan guli darol La Perouse, nagan nurinang nalamanang bijigul gadigul, nagan gamamaringai darwalenga. Welcome, Auntie Lola, and I am a Darawal elder from La Perouse, and I acknowledge we are gathered on the land of the Bijigul and Gadigal, and I introduce myself in our Darawal language, a language that has just been brought into our community through many years of research through our Gajaga Foundation, and I'm only just starting to learn it in the last couple of years, so I don't know if I'll ever get fluent, but they say the older you get, you're better off learning a language, so why not? They say it can help prevent dementia and Alzheimer's, so fingers crossed it works. So I'd like to pay my respects to elders past, present and emerging, and extend that respect to all of you here today. It's really a pleasure to be back here. I was here last year to welcome you all, and you know, mental health is such an important thing to work in. I worked for 21 years as an Aboriginal health worker in child and family health for Sydney Children's Hospital, CESLID, and the mental health with the mothers was very draining, so now I'm retired because they drained me. And but I still get involved with many things that, with the child and family, domestic violence stuff, so I like to be a part of that voluntarily, so just so that I can always be there for someone for them to talk to. But I won't let them drain my retirement, okay? So I always thank our elders and our ancestors for caring for the land. You know, they only took what they needed to survive, our ancestors, and that is how we have survived for over tens of thousands of years. And, you know, and it was always to keep the land viable so that it sustained the food and the wildlife and that always ensured that none of our families ever went hungry. So on behalf of my ancestors and my community, I wish you all a very, very warm welcome. As spiritual people, we believe our ancestors are always with us, so may their spirits be with you, keep you safe on your journeys wherever they may take you and into the future. And I'd like to say congratulations to all of you prize winners, and thank you for all your services that you do for all the communities around Australia, you know. And it's very important to look after mental health and to bring solutions to suicide prevention. So with that, I'll say Budgerine and Wabi. It means thank you. Have a great day.
Thank you, Auntie Lola, and I'm glad that you're making time for yourself and those beautiful grandchildren and not letting anything drain you. So thank you for welcoming us, and I want to also acknowledge we're on the traditional lands of the Burdekin and Gadigal people and pay my respects to elders past and present. I also want to acknowledge that today we're very lucky to have the Honourable Emma McBride MP. She's the Assistant Minister for Mental Health and Suicide Prevention and Rural and Regional Health joining us, and she'll be presenting the awards for the third time. And Minister McBride's been a really big supporter of the awards, and so we really honour and value her contribution. So this is the 10th year of the Australian Mental Health Prize. How awesome is that? A round of applause. And so I joined the advisory committee in 2016. That was the year the prize was established. And I just want you to cast your mind back to 2016 because it was a very different world in a lot of ways, and certainly the mental health landscape was very different. So there was still a lot of stigma about mental unwellness, but particularly conversations about mental health really didn't happen in workplaces and schools, the way we do now. And the prize was really created to change the dynamic and the conversation about mental health. And we wanted to shine a light on people who were driving progress, the amazing Australians who are making a difference, whether that was through lived experience, professional expertise, Indigenous leadership or grassroots action. And over the past decade, we've really been able to acknowledge some amazing Australians, leaders of all kinds, who've really shaped policy, inspired compassion, and proven that leadership in mental health comes in many different forms. And so the prize's impact is not just felt today on the day we give out the prize, but really changing the national conversation. And the winners from the last 10 years and today's winners, they really embody that spirit of courage, that creativity and humanity that defines this sector and why so many of you want to work in this sector. It's the passion. Today is really a special moment. We can look back on that decade of advocacy and leadership and impact, and also look forward to the next decade as well. And I want to thank you for joining all of us, taking time out of your busy days to be part of this event. It shows how much you care about mental health as well. And we're not only going to look back, but we're going to talk about shaping the future of mental wellbeing. So please join me in welcoming, for our official opening, Professor Vlado Perkovic, the Provost of the University of New South Wales.
Thanks so much, Sophie, and thank you for not just joining us here today, but for your involvement in this prize. Your commitment and support to the area and to the university is very well appreciated, and we're grateful to you for all the work that you do, really. I'd also like to begin by acknowledging that we're meeting on the lands of the Burdekin people, pay respects to elders past and present, and also reflect on what we can learn from the Aboriginal communities that have lived here over such a long period of time about how they cared for each other and their community, and perhaps there are lessons for us that we should take account of when we're thinking about the sorts of issues we're dealing with today. But I'm also absolutely delighted to be here for the 10th anniversary of the Australian Mental Health Prize. We're into double figures, that's very exciting. And our Vice-Chancellor, Attila Brungs, is incredibly disappointed not to be able to join us today. He's in China at the moment and asked me to express his very sincere apologies for missing this event. But the good news about that is that I get to be here instead. So I'm even happier to be here. And this is the fourth, I think, of these events that I've been able to attend, initially as Dean, then as Provost, and today as Acting Vice-Chancellor. And let's make some changes while he's away, shall we? Oops. And the striking thing really is, to me, about attending several of these events now is about firstly, the sense of community that exists amongst people working in the area, and it really is a very tight group and one that has had such a profound impact, particularly over recent years. And secondly, the incredible generosity of spirit that I think defines that community, with the selflessness, the dedication to improving outcomes for the entire community that really is such a feature of the work that's being done. But it's been fantastic to see the prize grow to reflect the breadth of leadership and experience across the sector. 10 years ago, when the prize was established by our leaders here at UNSW in the then School of Psychiatry, it had a simple but powerful vision: to shine a light on the individuals and the communities driving positive change in mental health across our nation. In that first year, there were more than 130 nominations from around Australia. 130 in the first year. And I think that just highlights the hunger that existed for a platform that recognised champions in this critical area. And since then, the prize has continued to grow and evolve, and our understanding of mental health and the things that we need to do to address it have really grown and deepened. And today we've got 4 categories where we celebrate excellence: Aboriginal or Torres Strait Islander leadership, lived experience, professional leadership, and community hero. And together, these categories tell a story of inclusion, of collaboration, of shared impact. And these are values that are central both to the prize, but also to the work that we do here at UNSW. So 10 years in, 23 extraordinary Australians have received this honour, and each one has demonstrated that leadership in mental health takes many forms. We've seen systems change, we've seen reduction in stigma and improved care for countless Australians. But the impact of the prize extends far beyond those who are recognised as winners. Every year, the nomination process itself becomes a celebration and shines a light on people whose work is often unseen. And I think for everyone who's nominated, we should really extend our deep congratulations. For many of those who are nominated, just the recognition alone can be deeply meaningful, a way of saying that their contribution matters, and the impact of that speaks for itself. Past winners have gone on to influence national policy, expand community programs, and in some selected cases, I see Marie Toombs sitting over there, have come here to join us at UNSW. So welcome, Marie. And Marie is, of course, now our Associate Dean Indigenous in our Faculty of Medicine and Health. But the prize has also helped to shape public and national conversations through media coverage, through sector engagement, the message of hope, of impact and community, as well as progress that this prize represents, has reached more than 12 million Australians. And if we quote last year's winner, Professor Julie Coffin, who so beautifully said, "I felt grateful to have this opportunity to showcase what we're privileged to see every single day. I get to see hope and change every day, and the prize provides an amazing chance to share this with the rest of Australia." So it really is a fabulous activity, and at UNSW we're really proud that this platform, which was born from our community, has become a national symbol of collaboration and of progress. It also reflects the university's broader commitment to mental health research, to education and advocacy. And there's countless examples of across the university that we could use to highlight some of that, but let me just share a couple where we're currently contributing evidence that informs practice and improves outcomes. One example is work that's being done in partnership with the Black Dog Institute, leading a recent landmark global study into doctors' mental health that was published in July this year, that's helping shape safer and more supportive workplaces for clinicians. Another study published this year, our academics contributed to the Lancet Psychiatry Commission's influential report on lifestyle interventions, work that continues to inform how we approach health and well-being and links mental health with general well-being and health more broadly. I'd also like to take this opportunity to acknowledge Professor Henry Brodati, AO, who is here with us today and is one of Australia's most respected clinicians, researchers and advocates for people living with dementia. In fact, I think, Henry, you were also recognised yesterday by The Australian, if I've read correctly, as being Australia's top researcher in ageing, or... There you go, news to you. So the accolades just keep coming. There are so many, even Henry can't keep up. And of course, the reason we're additionally recognising Henry today is because he was recently named the 2026 New South Wales Senior Australian of the Year, so a very fitting recognition. So all of this really reflects UNSW's mission, our strategy of progress for all, our determination to create spaces where we can all engage in critical conversations and where partnerships that involve universities, government, and the community can drive real change and real impact. So today, as we celebrate 10 years of the Australian Mental Health Prize, we also look to the future. And the issues that we face are complex, they're not getting any simpler. The world continues to change and evolve and throw up new challenges that we all have to deal with. But our collective strength across sectors and communities gives me great confidence that we'll continue to do that very successfully. So in the spirit of partnership, it's now my great pleasure to welcome the Assistant Minister for Mental Health and Suicide Prevention, the Honourable Emma McBride MP. Together we're shaping a future where mental health supported, celebrated and understood as everyone's responsibility. So to all of you, thank you and congratulations again to all of our past and present nominees and winners, and I look forward to being inspired again by the amazing work and impact that our winners this year will do. Thank you very much.
Good morning, everyone. I'd like to begin by acknowledging the traditional custodians of the land on which we meet, and I pay my respects to elders past and present and extend that respect to all First Nations people here today. And to Auntie Lola Ryan for her generous welcome and that contribution of more than 2 decades as an Aboriginal health worker in child and family services. To the University Provost and Acting Vice-Chancellor who has promised some rapid change. When is Attila back? He'll be wondering why there's no Wi-Fi on his flight from China. To the Head of Population Health, Professor Rebecca Ivers. To Henry, as I've just learnt, New South Wales Senior Australian of the Year, and Henry did take the chance to lean across and say to me, Emma, in the past, Prime Ministers and Governor-Generals have been here, so I think that's a request for me to go and talk to the PM. So I'll take that on board. To all of the past winners and this year's nominees, and to those of you here with lived experience of mental health challenges, as has been said, this year marks the 10th anniversary of the Australian National Mental Health Prize. And thinking back when Sophie was talking about the inception of this prize, that was the year that I first entered Parliament, having worked for more than a decade in acute mental health inpatient services, and to see the change that has occurred in society, in healthcare. You were part of that change, and it's something that everyone should be proud of in this room. It's exciting for me, as it must be for the organisers and the founders of this prize, to see how the awards and those who are recognised in them are evolving. That these national awards now honour and acknowledge lived experience leadership, Indigenous leadership, community heroes and professional excellence, recognising the many ways that individuals contribute to improving mental health support and care. And our government is strongly committed to working alongside you to improve the mental health and wellbeing of all Australians here in New South Wales and across the country, to make sure that more Australians can access mental health care when and where they need it. And I believe together we're making progress. And I have to again thank all of those people who've provided advice and guidance to us as we work towards these changes. Some of you are here today. This financial year, the Commonwealth is committing $7.8 billion to mental health and suicide prevention. But the transformation isn't simply about increasing funding, important as that is. It's about delivering better care, earlier intervention, and building and fostering stronger partnerships. And I believe we're starting to see these results. Only a few weeks ago, I was delighted to officially open the 50th Medicare Mental Health Centre in Campbelltown in southwest Sydney. We're well on the way to delivering 91 across the country, where people can walk in to a welcoming place, greeted by a peer worker, and seek support. They don't need an appointment and they don't need a referral, and it's for free. And we recognise people with lived experience of mental health challenges and suicide, including families and carers, are central to shaping better systems of support and care, which is why this year we're very proud to have established Australia's first National Mental Health Consumer Alliance and Mental Health Carers Australia, peak bodies nationally to elevate and amplify the voice of lived experience, to guide us as we, alongside policymakers and clinicians, work to make care more responsive and compassionate. That's why care and support is changing, and that's why all of our services are embedding lived experience and peer workers. And we remain on track to deliver our other commitments too, like perinatal mental health centres for expecting and new parents, and expanded and upgrade Headspace network to 203 centres across the country, 20 new youth specialist care centres and kids hubs for children and families. And tomorrow will mark a new milestone in our new National Early Intervention Service, which will be launched next year to provide free mental health support and care to everyone, wherever they live. And continuing alongside First Nations leaders to implement First Nations mental health and suicide prevention programs, including in partnership with Dudgeon. The Aboriginal and Torres Strait Islander Lived Experience Centre, formerly housed by the Black Dog Institute here at UNSW, has transitioned to an independent, First Nations-led organisation, making sure that lived experience and First Nation leadership guide our national approach to mental health and suicide prevention. At the same time, we're building the mental health and lived experience workforce, funding more than 1,200 extra training places for mental health professionals and peer workers, with special attention to First Nations communities, culturally and linguistically diverse communities in rural and remote areas. Our goal, and I'm sure it's the one that we all share, is to make sure that every Australian can access the mental health support and care that they need by meeting people where they are, by providing support sooner before distress becomes crisis. And in this, you are our pace setters. Your contributions, your research, your leadership and your lived experience are transforming mental health care in Australia, something that you should all be very proud to be a part of. And that is what these awards are all about, and why their impact extends way beyond these walls and beyond the people that are taking part. And I do believe that they have been and continue to be a catalyst for real and enduring change. So congratulations again to all the nominees, and thank you all once more for your ongoing contributions to improving mental health care in Australia. Let's keep working together, let's keep driving change, and let's help create a healthier and fairer Australia together. Thank you and congratulations.
Thank you very much, Minister. And as I said, we really value your support, and we're so grateful you could make the time to come again to be part of this event. So I would love you to stay on stage. You're going to take over and I'll just be the barrel girl passing you things.
It's never a barrel
To announce the first winner in the category of Aboriginal and Torres Strait Islander leadership.
Our 2025 Australian Mental Health Prize winner for Aboriginal or Torres Strait Islander leadership is Professor Dudgeon. Born in Darwin and descended from the Baradi people of the Kimberley, Professor Dudgeon is Australia's first Aboriginal psychologist and a national leader in Indigenous mental health and suicide prevention. As Director of the Centre of Best Practice in Aboriginal and Torres Strait Islander Suicide Prevention at the University of Western Australia, she's been instrumental in embedding cultural, strengths-based and lived experience perspectives into policy and services. Her landmark project, Solutions at Work, reframed national understanding of suicide prevention by centring Indigenous-led, culturally grounded responses. The Professor's leadership continues to shape research, policy and frontline practice across Australia. Unfortunately, the Professor is unable to be with us in person today, but has shared, I believe, a special video message, and we are delighted to have Julie here to accept on her behalf.
Good morning. My name is Professor Pat Dudgeon, and I'm making this recording on Wajak Nyunga Budja in Perth. My people, even though I live and work on beautiful Nyunga country, my people are the Bardi people from the Kimberley region. Before I start, I'd like to acknowledge elders, past, present and emerging, and recognise the strength and resilience of Aboriginal and Torres Strait Islander people in communities all over Australia. I'm disappointed that I can't be with you in person today on Burdekin country. So my apologies to all. And it is a very important ceremony, and very important that we recognise our leaders and workers in the mental health space. But for me, it was an honour to be a recipient of the 2026 Australian Mental Health Prize. It's wonderful recognition on the work that my colleagues and I have developed over 2 decades, and to shape the understanding of Indigenous mental health and well-being, describing our own experiences in our own terms. The concept of social emotional well-being is more holistic than the notion of mental health. For us, it encompasses connection to our mind and emotions, our body, family, kinship groups and community, also culture, country and spirituality. We understand these connections in the context of social, political and historical determinants, so they do not exist in a vacuum. This means that our health as individuals cannot be separated from the health of our loved ones and communities or the circumstances of all Aboriginal Torres Strait Islander people. I'm encouraged that social emotional wellbeing, or SUB as we refer to it, is now an accepted part of policy and practice, and many more of our own people and those working in mainstream services are becoming familiar with it. The SUB model is an integral part of the National Aboriginal and Torres Strait Islander Suicide Prevention Strategy released last year. SUB also underpins the Guy Dewey Proud Spirit Framework and Implementation Plan, which is a blueprint for promoting leadership of Indigenous people in mental health systems. We have a SUB policy partnership, which is a commitment under the National Agreement on Closing the Gap. This is a mechanism for shared decision-making between governments and Aboriginal Torres Strait Islander people. More funding is flowing into Aboriginal Torres Strait Islander organisations to implement solutions under our design, implementation and governance. Culture Care Connect, a national suicide prevention training and aftercare program, is a great example. It's delivered by the National Aboriginal Community Controlled Health Organisation, NACCHO, with local co-design in more than 30 communities across Australia, and it's proving to be very effective. But there's no room for complacency. Despite all these great advances that I've witnessed, there's no room for complacency. The Australian Bureau of Statistics released the 2024 suicide figures on Friday, and they show that Indigenous suicides have continued to rise. Those numbers are now at nearly 3 times the rate of other Australians. Indigenous people continue to experience racism, both at a systemic and individual levels, and this is linked to higher levels of distress and then suicide. The Productivity Commission review of the National Mental Health and Suicide Prevention Agreement has confirmed the current mental health system architecture does not meet the needs of Aboriginal and Torres Strait Islander people. It has called for a dedicated social emotional wellbeing schedule within the next agreement. So there's much more to be done, and I'm grateful that the Centre for Best Practice in Aboriginal Torres Strait Islander Suicide Prevention at the University of Western Australia has been generously funded by the Department of Health, Disability and Ageing, taking us through to 2028. So we've got our work to do as well. We will be expanding our research and collaborations and bringing some important new programs into the centre to be overseen by Professor Helen Milroy and myself, and we will be soon renaming the centre to reflect its Aboriginal identity and growing remit. So watch the space. I'd like to acknowledge some other colleagues, past and present, whose contributions have been integral to the shared work and achievements recognised by the mental health space. And they include leaders such as Professor Helen Milroy, Professor Tom Kelmer, and the many other people who are working out there in our communities. I think I was a little bit embarrassed when I was given this award, and I thought, I'm merely the figurehead of a whole movement that's happening. And there are lots of programs, lots of Indigenous leadership at regional levels that's all happening. So I'd like to acknowledge all the different programs, the culturally based programs that are community-led and community-based, and all the people who really work hard to make them happen. They will take us into the future. Okay, the centre is fortunate to have a wonderful research and support staff, both Indigenous and non-Indigenous, and I thank them for all their hard work in this challenging space. Thank you to the Assistant Minister McBride for presenting the Australian Mental Health Prize, which my colleague, Julie Rowbotham, is in Sydney and will accept on my behalf. Thank you also to the University of New South Wales for establishing and organising these prizes over many years, and congratulations to my fellow prize recipients. So I think it's fabulous that our work in the sector, and it is hard work for all of us, is recognised and celebrated. In conclusion, I'd like to say enjoy yourselves tonight, celebrate our achievements that we all share, and my very best wishes for a wonderful event today. Thank you.
Well, it's a great honour to be here today on Pat's behalf to accept the Australian Mental Health Prize for 2025. It is a formidable body of work and an exceptional person, and speaking personally as a non-Aboriginal member of Pat's staff, just such an honour and privilege to be able to support that work. I will be in Perth next week with Pat and look forward to handing this over to her in person, and we'll send some photos along. Thank you very much.
Thank you, Julie, and congratulations once more. And please give our best to the Professor when you're in WA next week. The 2025 Australian Mental Health Prize for Lived Experience this year goes to Hugo Toovey. An Army Major, Hugo faced cancer twice in his 20s alongside depression and PTSD, experiences that have shaped his powerful advocacy for young Australians. He founded his own charity, 25 Stay Alive, a charity encouraging young adults to take their physical and mental health seriously, and has worked with national partners such as Movember and Gotcha for Life to promote early intervention, connection, and resilience. Through his openness, courage, and humour, Hugo has helped countless people find purpose and strength through adversity. Congratulations, Hugo.
Thank you so much, ladies and gentlemen. I will be speaking with a little lapel mic in a second and just share a bit of my story, but I just want to thank everyone for being here today, the other award winners, the University of New South Wales, Sophie, the board, Auntie Lola, thank you for being here. And it's a real privilege and an honour to be recognised in this way. And it means extra significance for me. 5 weeks ago, I was coming out of life-altering major surgery. 5 weeks today, even being here is something that I'm very grateful for. I didn't think I'd be able to be here today, but it gives me so much motivation and purpose to know why it's the work I do and why this matters. And I'd like to now share the story that brought me to this moment, a story of loss, survival, vulnerability, and turning pain into purpose. A story that began 15 years ago when I joined the Army. And the significant part for me is that I'm still currently serving. I've been here for 15 years. But outside of that, I've gone through, as you'll see in a second, significant hardship. And I think that's such an important thing to mention, is that mental illness can often be that invisible illness. And even standing here today, you probably wouldn't realise that I've had over 12 or so major surgeries. Recently, 5 weeks ago, I've now got a permanent stoma. My quality of life for the rest of my life will be impacted. But once again, from the outside, I probably look like a pretty normal young Aussie bloke. And that's why it's so important that we always check in on our friends, our mates, and you never know what someone's going through. And some of the friends and mates that you see in this photo are some of my best friends, my Gotcha for Life people, grooms at my wedding, people who I've been friends with for a number of years now. When I'm going through a difficult time, I know I can rely on them. Unfortunately, my best mate, who you don't see in that photo, his name was Midshipman Peter Bark. Pete was 203 centimetres tall, AFL ruckman height. He had a cheeky grin. He was the life of the party, and he was the sort of guy that would drop everything to go and be with you. Any problems that you had, he'd be the first to be there. But unfortunately, as I spoke about with invisible illness, underneath that cheeky smile, Pete was really struggling. And one particular morning, Pete ran into my room like he often did. We lived next door to each other. He gave me a big hug and he said, "I love you." And I said, "I love you too, mate. Can we chat a bit later about this?" Getting ready for the day, didn't think much of it. Tragically, that was the last time I saw my best mate. And later that afternoon, at the age of 22, his whole career and life ahead of him, he took his own life. It was a significant time in not only my life, but the people he had impacted. And I vividly remember being a pallbearer at your best mate's funeral, a military funeral. It's not something you think you'd be doing at such a young age. But what it did, for me, it put a spotlight on the significance and seriousness of mental illness and suicide, and the simple fact that it does not discriminate, it does not matter who you are. But by talking about Pete, his legacy lives on. I've still got a beautiful relationship with Pete's mum, Maria. In fact, we speak regularly. And I think by talking about people like Pete, and I'm sure there have been many people in the room who have been impacted by suicide, not only does their legacy live on, their memories live on, but it will make us realise that there are people like Pete that are going through their personal struggles and challenges. And I'd like to think he's looking down on me and he's proud of the work I'm doing. And if every time I get an opportunity to talk about him, I have a smile. But I just wish he was here and I wish I could give him that hug. But over the coming years, that legacy that Pete left, the core group of friends I just showed, we became even stronger, and we made a pact and we said, "Lads, if any one of us are struggling, if we're going through a difficult time, reach out to one another." We've still got a group chat, and if it's not every day, it's every second day. Whether it's banter, checking in, giving each other a call, we're relying on each other, that sense of connection to get us through difficult times. And for me, the unexpected difficult time was 6 months before I graduated from the Australian Defence Force Academy. I had six months after a 4-year block of training. I was the fittest and so I thought healthiest I'd been in my whole life. And I remember calling my dad on the 18th of June 2013, 21-year-old bloke, and said, "Dad, I've got this lump on my right testicle. What do you reckon?" And he said, "Mate, have you gone to a doctor?" And I said, "Of course not. I'm a young 21-year-old, I'm bulletproof, why would I go to a doctor?" And he said, "Mate, don't be an idiot, go off to your doctor." So I did, went to the doctor, had a feel around, he said, "Mate, we'll send you off for an ultrasound." Later that day, got diagnosed with testicular cancer. Not only did I get diagnosed with testicular cancer, me being that ignorant young 21-year-old bloke meant the cancer had spread through my body. So I really embarked on the next couple of years of treatment, recovery, chemotherapies, multiple surgeries. And I managed to put off the chemotherapy so I could still graduate from the Australian Defence, from the Royal Military College Dundee. There, pictured with my twin brother Max. Proud moment, graduation, throwing the hats in the air. How good is this? My whole life ahead of me, young lieutenant in the Australian Army. 6 days later, my brother did the honours, shaved my head, and I embarked on some very intensive, gruelling chemotherapy, followed up by what's called a retroperitoneal lymph node dissection, the first of now many open abdominal surgeries. And during those years, as a very vulnerable young man, you're expected to know everything. You're expected to, "You'll be right, you're young." And every time someone would see me in hospital or see me with my chemo, loss of hair, they'd always say, "Mate, you'll bounce back, you're young." And I think when you hear that, you feel like that's the person you need to be. And that was the start of the decline of my mental health. And that smile you see on the far left, I got very good at putting on that mask, that smile. Anytime anyone would ever see me in hospital, I was that super positive guy all the time. But as we know, you can't be that person every single day. A number of years went by, and I eventually started ticking off the milestones. And for those who have been through cancer, you'd know the significance of a 3-month scan, a 6-month scan. And for me, it was ticking off those milestones and realising I could start living my life again, because life does go on. I met my now wife. We moved to Brisbane. We embarked on a new life together. I got the 5-year all-clear scan for testicular cancer. So for those that know the significance of that, it's a milestone. I remember favourite bottle of champagne, Verve. We cracked it open in Brisbane. We had a cheers, and for the first time in my adult life, I had a sense of freedom, happiness, and I felt like cancer no longer defined my life. My mental health was in a really good stage as well. But only 2 months after getting that 5-year all-clear scan, my bowels started playing up. And I thought, hang on, this isn't normal. I went off to a doctor, ran a few tests, and he said, mate, we're going to have what's called a colonoscopy. Out of interest, who here's had a colonoscopy? There's a good chunk, about half. You'd probably know that the hardest part's the bowel prep. I always look at it as a nice, good cleanse, just really get things going. And I remember going in for this colonoscopy, thinking nothing of it, doing the token little selfie in the mirror, having the best little 15-minute power nap you'll ever have, and I was like waking up, waving to the people next to me, feeling fantastic. Best turkey sandwich you'll ever have, best biscuit you'll ever have. And Terry, my gastroenterologist, came over to me and he said, Hugo, mate, you had a couple nasty polyps, which at 26 years of age is a bit unusual, but we're going to send it off for a biopsy and, hey, let's see you in 2 weeks' time. And I literally got my phone out, Terry, 2-week appointment, fantastic. Went to work the next day, in my army uniform, typing away at my desk, got a call from Terry's receptionist, and she said, Hugo, Terry needs to see you. I said, yep, I've got an appointment booked. She said, no, Terry needs to see you today. And when you've got a specialist wanting to see you that day, it's typically not to pat you on the back. Amber, my wife's a nurse, and she had just finished a shift at a hospital. We went to this appointment together, and that default setting, smile, hiding behind this uniform, pretending I was fine, just came out again. But underneath that, I was shit scared. Amber was worried, but we kind of put on this brave front, because that's once again the person I thought I needed to be. And Terry pulled us into his rooms, and he had this sombre look to his face, and he sat us down and said, Amber, Hugo, I'm sorry to say you've got bowel cancer. This was a completely unrelated cancer. It had nothing to do with testicular cancer. It was a new primary cancer. I've since had genetic testing. I've got no mutated genes. They've honestly put it down to a bit of bad luck. But being there in that moment, being told you have bowel cancer at 26, to relive that again 2 months after being on top of the world is a lot to go through and a lot to the mental strain that can bring. I remember sitting there very silent. Amber had her hand on my knee, and I left that appointment, I just burst into tears. And it was the first time in my adult life where I had a really big cry. Not knowing if I'm going to get through it, but also knowing the pain and the impact it can cause family, Amber having to go through it. It's a very difficult thing because you feel that sense of guilt, even though I couldn't help it. I remember calling my old man, he didn't even know I was having a colonoscopy. Knowing what it would be like as a parent to get that call, Dad, I've got bowel cancer, just after getting through that previous cancer. It's a lot to go through. And he said, mate, I'll be on the next plane. And for me, it was a very difficult years ahead. Multiple surgeries to remove part of my bowel, then eventually major surgery to remove all my large bowel, the radiation, the immunotherapy, the treatments. I did everything I could. Ultimately, it came to a situation at the end of 2019 where I had to have another big chunk of my bowel out, so I no longer had the large bowel, colon, rectum, and the life that I knew would be very different. And this particular slide is a powerful slide I wanted to share today. It was my absolute rock bottom. It's absolutely when I was depressed. But the reason, the significance of why I want to share this slide is physically you can see I'm unwell. I'm kept alive in what's called a TPN pouch. I couldn't have a sip of water for a few weeks. I lost 22 kilos. It was very touch and go for a while. The photo on the right, you can see the stoma bag, all the scars. But mentally, that person I was in that photo, that was my 95% of the time. That's how I felt. And some of that pain I was going through was more painful than the physical stuff. So for those who have never been through mental illness, now knowing what it must have been like for my best mate, Pete Bark, to think suicide was his only way out to make that pain stop. It is an illness, no different to cancer. It's just it's sometimes a lot harder to see. And for me, I was doing everything I could. I had pain specialists and surgeons and people come in every day. What can we do to make his physical health, his cancer, get better? But I was doing nothing for my mental health. Not one thing. Every time Amber would come into the hospital, I'd put on that smile, crack a few jokes. She would leave the hospital every day and I'd often burst into tears. And there was times I didn't actually want to get better. I didn't want to get out of that hospital. I'd had enough. But what got me through rock bottom, what got me through those really challenging times, and what still gets me through today is my connection, my family support, those people in my village. Doesn't matter if it's one person, 2 people, 5 people, if you're lucky enough to have 10 people. Having that person or people in your village when you're going through a difficult time that you can be open and vulnerable to will make it that little bit easier. You realise you do not have to go through these challenges alone. And it doesn't have to be something like cancer. It could be your own version of whatever your challenge is. You don't always have to put on that brave front, especially young men. There's a lot of courage in vulnerability, about being open, about expressing your emotions. And for me, it was that realisation in hospital to realise that I had to do more of it. I had to be more open to Amber. And the more open I was to her, the better it made me feel, and I realised that I can't get through this alone. And now what makes this particularly raw is, like I said, I'm only 5 weeks from my most recent surgery. I've very quickly condensed this presentation today to try and get through a few of the key points, but the reality is this has been going on for over 12 years. I've now only got less than 2 metres of bowel total. To put that in perspective, the average human has 8 metres. You can live with around 1, so I've got about 50 centimetres to play with. Cutting it fine. But ultimately, this recent surgery and this recent hospital admission, the resilience that you learn unintentionally that equips you with overcoming challenges is immense. And when I went through this particular hospital admission 5 weeks ago, I had to lean on the old version of me, that young guy who couldn't get through it by himself. And I've now got that exact photo on the right on my phone with a well-known quote called "This too shall pass." Because whenever I have a difficult time now, like this recent hospital admission, I'm reminded myself that I got through this time when I was at rock bottom and I did not think I'd get through it. I compare myself to another version of myself when I've overcome these challenges, and it just gives me that little bit of hope and motivation to think, you know what, I'm going to get through this too. So if you reflect on a time in your life when you overcame hardship, a loss of a loved one, your own personal struggles, and you look back at that and go, shit, I've actually got through it. I'm stronger than I think. The human body is remarkable. It is resilient, it is strong. And this next sort of 50-second clip is my time in hospital. I was there for a few weeks, and you'll see another little addition in the hospital, which gave me the biggest motivation of all. Lights will guide you home and ignite your bones. I will try to fix you. The joy that I get from my son, for someone who's so small, the boost that he gives me and continues to give me, it's something that I'll always be grateful for. And we didn't think we could conceive, and after a long time of trying, we did welcome our son. And when you're going through a difficult time, him running into those hospitals, he doesn't know Dad's unwell. I have to show up for him. I'll continue to show up for him. but I want to do it for his generation and future generations when he grows up. He's proud of his dad. It's okay to give your old man a hug, to have a cry, and to show the strength and vulnerability. And that was really the motive in starting my own charity and turning those scars into purpose. Making the best of a pretty shitty, pun intended, situation. Using what I've gone through to make some good. And when you start sharing your story, realising it can help one person, 10 people, 100 people, 1,000 people, when you can realise your story can save lives. And through our charity, it's all about encouraging young adults to be proactive with their health, to not realise that, to realise they're not invincible, they're not bulletproof. A lot of young adults in their 20s and 30s are navigating life, starting a new career, profession, moving interstate. They're young, right? They're fit, they're healthy. We know the statistics and rates around suicide. These cancers that now impact young people, something like bowel cancer is now the biggest cancer killer for those aged 25 to 44. They're not older person's cancers. These young people need to start taking action now. Early detection, prevention. It's what's going to save lives. And through our charity and our amazing ambassadors, we also work with clinicians. We go into rural areas, country towns, sporting clubs. We have a lived experience speakers sharing their challenges and what they've gone through. We also have a clinician. We partner together. Our younger GPs who are kind of destigmatising what it's like to actually book in for an annual checkup, to do a skin check, to have a mental health treatment plan, to realise that it's actually not too daunting. And if we can encourage that young person to put their foot in the door and hear stories like myself to realise, you know what, there is hope, I can take action, then I've got no doubt we're going to go a long way to saving more lives. But we also know we can't do it alone. We're doing whatever we can to get as much support. We've developed what's called a 5-point checklist. For a young person who goes, what the hell do I even say to a doctor? They can take that in to a GP that's partnered with 25 Stay Alive. They go through a 5-point checklist. They realise, hang on, that wasn't too difficult. We'll see you in 12 months' time. Just like when your car bloody dings and says you're overdue for a car service, most of the blokes out there go, shit, I'm going to get 4 new tyres and get the oil changed. It should be the same conversation with your health. Even if you're feeling pretty good, to start these conversations at 25 for the rest of your life. And you can imagine how much that's going to go as far as preventing these illnesses and treating them before they turn into crisis. And to finish off, I just wanted to leave you with my favourite quote and something that I truly live by, is that life is so bloody precious. And often it's not until you go through these difficult times where you get that reminder, but in a way that's a beautiful thing where you're reminded to take every day for what it is, to embrace your family, to reach out to your mates, to be grateful to even be here. And I love this photo because my wife Amber, who's with me today, she's done so much for me. And often the carers and the support people, they need support themselves. And to see her on our wedding day, even though I was in a lot of pain, how happy she was, it made me realise why I keep doing this, why I keep showing up. And it was our 3rd wedding anniversary last night, or yesterday, which makes it particularly powerful. And hopefully there'll be many more to come. And I'd just like to leave you with a particular moment, which was a couple of years ago at the annual University of New South Wales keynote at the Australian Defence Force Academy. So quite relevant to this presentation. I was back at the ADFA auditorium sharing my story to the future leaders. I went on stage, I was vulnerable, I got emotional, and I showed them that there are different ways that future leaders can lead our country. Through vulnerability, through openness, through human connection. And what made it even particularly more powerful was that Pete's plaque is just outside of that auditorium. And I visited that plaque with a smile on my face, went back into that auditorium with a full circle moment, and thought, hopefully, Pete will continue to be proud of the work I'm doing. So thank you, ladies and gentlemen. I really do appreciate this award today. We've still got a long way to go, but we're bloody making a right step in the right direction. So thanks for all being here. Thank you for your time. Appreciate it.
Thank you, Hugo, and congratulations, Amber and Hugo, on your 3rd wedding anniversary and your new addition. I'd like to take a moment to acknowledge all those with lived experience and the additional challenges that can come with sharing personal stories and advocating for others, including your late best mate, Pete. Your courage and generosity are helping to drive understanding and change, and we deeply appreciate all that you do, so thank you again. Our next award is the Australian Mental Health Prize for Professional Leadership, recognising those who influence and innovation have reshaped mental health systems in Australia. This year's recipient is Professor Brian Burdekin AO. Professor Burdekin has been a driving force in reframing mental illness as a human rights issue, both nationally and globally. As Australia's first federal human rights commissioner, he led the landmark national inquiry into human rights and mental illness, exposing systemic neglect and transforming national policy. His influence extends internationally through his advisory work with the United Nations and his role in helping establish national human rights commissions in more than 70 countries. Professor Burdekin is unable to join us in person today, but has sent a video message, and we're pleased to have Rob, the Chair of Psychosis Australia and member of the New South Wales Mental Health Review Tribunal, here to accept the award on his behalf. Thank you.
Well, it's an honour to receive this award, and it means that I have an opportunity to again speak on an issue that has preoccupied me for the last 35 years. I'm so sorry I can't be here personally. A long-standing commitment means I'm overseas. Indeed, I'm on the high seas. But I'm delighted that somebody for whom I have enormous respect is going to receive the award on my behalf, Rob Ramjam. I'm also delighted that here this morning I understand will be people like Janet Ma, along with Rob, some of the first and most important witnesses in my national inquiry on human rights and mental illness 30 years ago. So I'm sorry I can't be here, but I'm delighted that there are some of our leading medical and scientific minds and people who've walked this long path with me for 3.5 decades.
I do have Brian's speech, but before that, Hugo, thanks for your story. The stories of individuals can change the world. I wish you all the best. As somebody who's now in my 70s, not 25 to 40, I wish you all the very, very best with your charity and what you're trying to do. I'd like to acknowledge that we're on the lands of the oldest continuous civilization on the face of this earth, a thing that we should be deeply proud of and celebrate on a regular basis. A culture that gave us the largest art gallery in the world, up in the Arnhem Escarpment, bigger than anywhere else, with more paintings than anywhere else, many of which date back to at least 35,000 years ago. Now, two things about this speech. It's Brian's speech, and I've had to make some changes because it was written in the first person and I've tried to do it in the first and third person. And I would just say anything that's offensive in this speech is what Brian did. All the rest is what I have done. So Brian wanted me to thank the committee for this great honour. He was truly chuffed to be considered for the award on the 10th anniversary of the Australian Mental Health Prize. I'd like to just tell you a little bit about Brian, some of which the Minister has already mentioned, but it's worth saying again. He was appointed the first Human Rights Commissioner of the Human Rights Equal Opportunity Commission in 1986. Australia was the first country in the world to establish a Human Rights Commission. So this is real groundbreaking stuff that's happening in this country, something else we should be proud of. What Brian went into was greenfields. Nobody had done this anywhere else in the world, and so we were doing it here. In 1989, Brian released his first report. It was called Our Homeless Children, Report on the National Inquiry into Homeless Children. When I was looking at his notes, it really struck me how powerful Brian can be. The title, Our Homeless Children, is really powerful. It's not somebody else's. This is our problem and something that we've got to deal with. It. Language can be so powerful when it's so simple. Sadly, the findings of that report was that there was a high level of mental illness and mental distress amongst children who were homeless. This moved Brian deeply and led directly into his inquiry into mental illness, which was released in 1993. Now, from 1990, when the Commission started taking evidence, to 1993, there were 1,372 individual witnesses covering every state and territory in the country. Some were individual witnesses, but there were many organisations, national federations, professional associations, unions, non-government organisations that also submitted evidence to the inquiry, which ultimately led to those submissions and the inquiry representing the findings from hundreds of thousands of Australians. At the release of the report, one of the senior members of government poo-pooed the report and said that Brian was I don't need to look at this bit because I remember it so clearly, that Brian was a passionate man with very little evidence to back it up. That minister hadn't read the report. On the same day, Graham Richardson, recently departed, sadly, stood up in the Senate and called on his government to implement the recommendations of the Burdekin report. And personally, there was the headline story on the front page of the Herald saying, Burdekin, passionate man, and I wrote a little one-liner into the Herald which they published saying, thank God for passionate men, we need more passionate people. And they did publish it. The really important thing about the report was that it established a really basic principle, which I personally don't think we've gotten to yet, and that's that mental illness is a human rights issue. It goes beyond the medical treatment, the psychosocial, which we're waiting for. It goes beyond all of those things. It is actually a human rights issue. And the failure to act by governments was an abuse of human rights of people with a mental illness. There have been, I once stood on the stage with Brian where I spoke first, he spoke second, and I had to point out that since federation of this country, there has been more than one inquiry, Royal Commission report on mental illness every year to cover the whole time from 1900 to 2025. There have been so many government inquiries reports prior to Brian's. What made his a landmark report, and I think still has incredible power today, was that his inquiry was the first to actually listen to and pay attention to the voice of lived experience. Many of the others took a lot of professional evidence, took legal evidence, but his was the first that actually listened to the voice of lived experience, which is why he wanted me to say to Meg, and God, I'm blocking names, isn't that terrible? To you, how pleased he is that you're here today, because you were two of the people who gave evidence very early on. What it meant was that people were empowered. They were not afraid to self-identify, and they spoke for themselves. And that was very powerful. This is part of his national legacy. Internationally, Brian has helped over 70 countries develop their Human Rights Commission and remains an advisor to quite a few of them and has professorships in a number of universities around the world talking about human rights. He also played a major role in advising the United Nations about policies and procedures for people with a mental illness and people with a disability. Brian has dedicated his life to two areas: the plight of young Australian children who are homeless and people with a mental illness. He established the Burdekin Foundation for Homeless Children over 30 years ago. and continues to support it both emotionally and financially. I'm pleased to say that he also provides that support and his friendship to Psychosis Australia, which I chair. Brian has made the point numerous times that Australia is a very wealthy country with finances to change what is happening for people with a mental illness. It is a matter of government choice, he says, where to invest that money. And it has, the money that it has. And sadly, that investment is rarely into the future of people with a mental illness and their carers. We note two very important investment decisions that were game changers at a national level. The Howard government introduced the National Mental Health Reform Program, which gave us partners and gave us personal helpers and mentors, day-to-day living, and a carers program, and it was an absolute game changer. The second one was Minister Butler's introduction of Partners in Recovery. Partners in Recovery program in my 50-something years of working in mental health was the biggest game changer that we've ever seen to the provision of mental health services. It made a massive difference to so many people. I'm going personal there, not Brian. Sadly, all of that funding has gone and the money has gone into the NDIS. So those incredibly good programs that came from a coalition government and a Labor government no longer exist. Policy without resources is just philosophy. There are so many reports, the Royal Commission into Cullen Park, the Eisen-Wolfenden report, the Burdekin report, even the relatively recent Productivity Commission report. Brian wanted me to finish with a simple statement. It is now time to put resources behind the policy and truly reform the mental health system for all Australians. It is a human rights issue.
Thank you, Rob, for accepting the award on your friend Professor Burdekin's behalf, and please pass on the best wishes of myself and Minister Butler. And congratulations for his extraordinary lifetime of advocacy and real profound impact. We now come to our final award for today, and we recognise the power of community, the compassion, creativity and care that can transform lives at the grassroots level. The 2025 Australian Mental Health Prize for Community Hero is awarded to Keith Donnelly, a mental health clinical nurse manager. Yes. A mental health clinical nurse manager, Keith founded Keith's Closet, a volunteer-led initiative that restores dignity and self-worth to people experiencing mental illness. What began in 2019 as a single wardrobe of donated clothing at the Prince of Wales Hospital has grown into a movement, now in hospitals and communities right across New South Wales. Through compassion, creativity and care, Keith has supported thousands of people, showing that small acts of kindness can drive profound change in mental health care. Congratulations, Keith.
Very good afternoon, everybody. It's such a great honour, genuinely, to be standing up here in front of a room full of incredible people. I'm just sort of looking back on the last few months, and I think I got a call from Sophie while she was overseas, and the line wasn't great, but it sounded like I'd been nominated for an award, and I was like, oh yeah, great, you know, fantastic nomination. As the conversation went on, she said, yeah, the date is booked and you need to attend and you'll be doing a little bit of a chat and congratulations. And I said, hang on, Sophie, just say that again. Did I actually win this award? She said, yeah. So at that point, I was really bowled over, really overwhelmed by getting the recognition like that Keith's Closet does and has done in the past. But to stand up here, like I said, gives me a really amazing honour, a hand on my heart. It's not a one-man job. as we all know, there's many people. My family are the backbone of everything I do. My wife and kids are massive advocates for Keats Closet. They managed to get on board with the Shoebox Appeal this year. They were in their jobs, they were in their schools, they were doing speeches to the school, the teachers, the pupils, and parents. And when I look back, certainly where my young guy Max is now, 11 years of age, it was a very different journey. I lost my mum at 10. Following year, when I was 11 years of age, there was a whole lot of noise downstairs. My 11th birthday, I thought, yeah, big celebration going on here today, great. Went downstairs, unfortunately, we heard that my brother died by suicide. So the party obviously turned to tears and a lot of devastation in such a short space of time for all the family. I was one of 11. A typical Irish family, you know, Foxtel, Stan, Netflix back then. So I was the baby of 11. Some sisters moved over to the UK. Some brothers hung around. It really was a very challenging time. I think from the trauma, I'm not actually too sure, but I managed to record this most horrendous stammer. And if this was a number of years ago, I don't think I would have been able to say my name is Keith Donnelly without it taking about 5 minutes. So again, obviously standing up here now is really a great thing, because I think for people who do experience that, you can feel really trapped inside. You want to have conversations, you want to get along with people, you want to learn and engage with everybody who you cross paths with. So childhood was a bit of a crazy time, never really sure what to do, what kind of job I would attend. So at the age of 15, I was introduced to what would you call him? I guess a support worker or a career guidance teacher in school, because I genuinely hadn't a clue what I wanted to do. And he just nods his head and said, I really don't know for you, you know. So this was a career guidance teacher. I was thinking, geez, if this guy is saying he's not sure, there's absolutely no hope for me. So I found myself working as a barman for a number of years back in Dublin, and I was just looking at everybody having a good time, so that wasn't something I wanted to stay around. I did a bit of taxiing, I did a bit of this, roofing at one stage, and that was a little bit dangerous. And then I remember meeting a really good friend of mine who said he worked in a hospital, an aged care facility back in Dublin, and he could get me in just as a cleaner or someone to serve up meals. So I thought, absolutely, let's do this. So I went in, and very soon after, you know, I really liked the engagement. I loved the older generation. We had great fun, and hearing their stories and meeting their family, it was something that I really warmed to, but I really wanted to get more involved. So I had, and I'm sure we all know, significant, amazing people that like we've just happened to come across in our lives who have really changed the dynamics of our future. And that lady for me was a director of nursing called Kay Began. And she came to me, I think I might have been 34 or 35 at the time. She said, look, we want you to go on and do your mental health nursing. And I looked at her and says, Kay, look, I was out of school at 15. I've genuinely no clue what happens in uni. I just know it's a time for very clever people to attend and reach the highs and have a great life. And this lady just kept at me. She said, look, there's something about you I really like, and I think with a bit of encouragement, you can achieve what you aim for. So age of 36, I said to Vic, okay, it's looking like uni for 4 years. And she was kind of going, yeah, absolutely, go for it. Our kids were a lot younger at the time, so she took a lot of the slack. And I went off to uni, and through blood, sweat and tears, 4 years later, managed somehow to have a certificate saying I was now a qualified mental health nurse. So not ones to kind of hang around. Australia was definitely somewhere where we wanted to come back to. My sister has lived here for many years, and she often encouraged me. Australia was the place to be. And so I had a year here in '97, had an amazing time. So we landed here about 9 years ago, and very, very grateful for coming and working as a nurse at the Prince of Wales Hospital. And I started in the MICU and the mental health ICU, moved across to Carlo, and just the team there were very, very inspiring. It wasn't just about sort of turning up and doing your job, but as a mental health nurse, it was more, what else are you able to bring? Have you got any ideas, innovation-wise? So I thought, look, I remember back in Ireland a few years ago, we had a young guy that came in with just a clothes on our back. He was going to be in for a lengthy stay, no family, no friends to support him. And I remember going to him and just saying, look, I might have some clothes at home. I'm happy to take in for you. So the next day I brought him in a bag of items, and you know, for me it was the game changer. It was that moment that I seen him smile, him just like lift his shoulders and chest out and think, look at the nice clothes I have on. And so I went to Gareth Marr at the time, who was our operations manager, and I said, look, it might seem like a silly idea, but I want to try and set up some kind of walk-in wardrobe style room in the mental health facility that is going to support the people coming in, either ambulance, a police car, any time of day, who don't have the basic essentials like me or you. So he was saying, yeah, you go for a kid, I'll be over here if you need me. I'm like, great, that's a great help, Gareth, but on we go. So the first major obstacle was actually finding a location, and the team before I got there had done a lot of work around reducing seclusion. They were very much up to speed, like the trauma and the long-term effects, obviously taking people into seclusion, holding them down and medicating them. So that room then became absent almost. It wasn't being used anymore. So Gareth said, look, wouldn't it be a wonderful story if we were able to change this room into such a negative space into something very positive? So when we went in 2019, we opened it up, and it's still standing, which I think a lot of the staff are very, very surprised that such a room in the Carlo Centre, which is a very volatile space at the best of times, the room looks untouched. If it was any other room, I think it would have been painted about 10 times. It would have needed new floorboards, new wardrobes. But it's like the people who we support get a real sense that we actually care about you. We want you to come in here, choose your own clothes, choose your own items, and help to restore your dignity. So that was just, like I said, I was working as a mental health nurse then, and the plan was that I would sort of continue that, and a short time later we had the opportunity then to access a mobile wardrobe van, so we got that donated to us by a very good friend. Following that, I got this random email in my inbox from the Minister Parks office saying, we're having a community cabinet meeting on such and such a day, and we'd like you to attend, and you have your choice to speak to me or Minister Jackson or any minister in New South Wales. So along I went. I'd met Rose Jackson previously. I met Ryan Park, and he absolutely loved the whole concept. I thought at one point he was actually winding me up because he was so impressed, and he was really happy and bubbly. I thought, this is brilliant, Keith. And I was thinking, okay, yeah. And we just explained, look, we really want to grow. We need to get into the hospitals. We need to set up a warehouse space that's a communal wardrobe as well. So not only for people in the hospital need our support, obviously discharge, and those doing it really, really tough need our help as well. So we sent in a proposal, and a short time later we managed to receive $185,000, which was really an absolute game changer for Keith's Closet. That allowed us to expand into 3 other areas. So we opened up in Shell Harbour, we opened up in Lismore, and we're just about to open up in the Forensic Hospital on the 2nd of next month. So that'll be our 3 closets. We managed to have a part-time staff member down there 3 days a week, and we now got an additional vehicle. And look, the future is looking bright, but we can't do it without many, many helping hands, our board, our volunteers, our family support, and most importantly, we really want to grow to help people across New South Wales and Australia, and hopefully one day overseas as well. So I'd just like to finish up and say thank you very much for listening. Thank you very, very much for being here. And Minister McBride, we would definitely like to have a conversation and see if you've got some spare change in your handbag. Now, look, just to build relationships and connections, and we know that you will be a really amazing person for us to talk to. And obviously, Hugo, I'd really like to engage with Hugo as well. And this is what this space is about. That it'll open up many avenues, many networks will grow. And thank you very much for listening. Thank you.
Congratulations, Keith. I was just thinking, why don't we get Keith and the whole gang and the whole family up for a photo before? You've got the whole tribe with you. Where's our photographer? Maya, is it Maya? Come on up. Let's get Keith and all the kids and your sister as well. Come along. Give them a round of applause. While we do that, I just needed to let you know, Hugo, it's International Men's Health Day, so Hugo has a keynote speech to give, so he had to give his apologies and leave, but I just wanted to let you know that's where he's gone off to spread his message even further to another audience. So give them all a big round of applause. There we go. It takes a village, and I just wanted to thank the Minister for presenting the awards to all our amazing winners today. Professor Pat Dudgeon, Hugo, Toovey, you heard his amazing story. Professor Brian Burdekin and all the work he's done for human rights and for mental health in Australia. And then, of course, Keith. And you can just see from their enthusiasm that this is just the start of the work that both Keith and Hugo want to do and to spread their message. And you can just see the difference that they're already making, that their stories that they're telling really matter and really make a difference. And that leadership in mental health, it takes all forms. It can be professional, it can be community-led, and we can all make a difference. That's, I think, what comes through these awards, is we all have that opportunity to make a real difference. So I'd now like to welcome Professor Rebecca Ivers, AM, the Deputy Dean of Global Engagement of the Uni, to the stage.
Thanks very much. And wow, what an extraordinary group of people we've just heard from. That was just, amazing. So thank you very much for being here. It's just wonderful to be here for this special celebration of the 10-year anniversary of the Australian Mental Health Prize. That was extraordinary. I'm here on behalf of our Dean, Professor Cheryl Jones, who unfortunately is unwell and can't be here. But we really just want to say a huge congratulations to all the award winners. Pat Dudgeon, she's like a national living legend, honestly. She's been someone I've looked up to for my whole career. Brian Burdekin, I'm not surprised he's not here because he's obviously off there and, on the high seas at various UN commissions. Again, an extraordinary career, an extraordinary influence. Hugo's, lived experience, really powerful. And I think it just really extends and shows to us the importance of telling stories. I think I know mental health can be a silent condition, and I think when we talk about it, people know, and we know that we're not alone. It's everywhere, and if we don't share our stories, people don't know. They look at you and think this is just a normal person living a happy life with their wife and their 3 children. They don't actually know what's going on behind. So I really do want to encourage all of us just to keep talking and sharing. And really, thank you so much. That's just such a wonderful story. You are a community hero, and I hear you. It's the whole family that's involved, and it's a huge community. Congratulations to you and the family for all your work and advocacy. It's really powerful, and I look to see you standing up here one day in the future as well. This is actually where it starts, when you have such great role models and advocates. So thank you, everyone. I really want to say, though, that 10 years ago when this started, though, we need to acknowledge the people who have put this prize together. together. The landscape of mental health did look very different 10 years ago. There was more stigma, less open conversation, and a deep need to recognise those working to change that. And so we did have a group of distinguished Australians, leaders in research, media, advocacy and lived experience who united with our school, UNSW's School of Psychiatry, to establish the Australian Mental Health Prize. So their vision was to recognise those whose work was transforming their understanding, challenging stigma, and inspiring a more compassionate national conversation. And I think we've done that. So some of those original committee members are here today and still advocating through their engagement with the prize. So I just want us to acknowledge those people. Of course, our chair, Adjunct Professor Sophie Scott, Professor Henry Pradati, Philip Mitchell. Where's Phil? Up here, Philip, and Valsamma Eapen, Professor Valsamma Eapen. So congratulations and thank you. And of course, we really can see the difference now. All the Australians that have been recognised through this prize, there's been advocates, researchers, clinicians, community heroes, peer workers. They've transformed systems, influenced policy and inspired compassion in every corner of our society. And of course now, the very fact that we now have a minister for mental health and suicide prevention, I think is testament to that. So thank you very much, Minister, as well, for your commitment and the work that you do, and for the investment of the New South Wales Government as well in mental health, which is so important. And of course now the prize is also more than just one national award, it's for 4. So leadership in Aboriginal and Torres Strait Islander health, lived experience, professional leadership and community heroes. And it does invite many nominations. It's got great reach and diversity, and that's what makes this prize so special. I also just want to take a moment to thank the advisory committee who devote an extraordinary amount of time, care and expertise to the prize. So they guide the direction and they serve the judging panel, carefully reviewing all the nominations to make sure that every story is recognised. And that is quiet work, it's behind the scenes, but thank you to all of you. And I also want to thank the nominators and the nominees, again, who are with us today. Not everyone can win an award, but the fact that you've been nominated also is, really recognising the important work that so many people in the community do in improving lives and challenging stigma. So thank you for your leadership, compassion and persistence. This is what keeps our community moving forward. So thank you, everyone. It's been an incredible morning. We've been very proud at UNSW to host and nurture this initiative in collaboration with leaders across the mental health sector. And we have built a platform together that not only recognises leadership but amplifies it, helping great ideas and great people reach wider audiences. So it's fantastic to celebrate the 10 years of this mental health prize, but let's look forward and look to the next decade of progress, collaboration and care. So on behalf of UNSW and the Faculty of Medicine and Health, thank you to everyone for your commitment, your courage and your extraordinary contributions. And again, congratulations again to all of our winners and to all the people who were nominated. It's now my pleasure to hand back to Sophie Scott to wrap up. Thank you very much.
Thank you very much, Professor Ivers. And look, I just wanted to reflect on how we've heard some amazing stories today of great compassion, great achievement, of people who've gone over and above what they've had to do to give back and to really make a difference in mental health. And I think what also I want to say is that we're stronger together. And so if you can think of any ways that you can support Keith, support Hugo and the great work that he's doing, think about how we can use our own networks and resources to support the people you've heard from today to help them do even more great work in the future. So I'm definitely inspired by what I've heard, and I hope you are as well. And please stay now and have a light lunch with us out in the foyer, and we'd love to connect and network with as many of you as possible. But thank you so much for giving up. We know how busy you are, so thank you for giving up your busy days to be part of this important event. And we'll see you outside.